Joining me now to talk about health equity, I'm delighted to be joined by Nada Hamad from Sydney, Australia, and Sunil Bhat from Bangalore in India. Nada and Sunil, thank you both so much for joining us.
Thank you, Sam.
Thank you.
Nada, perhaps I could start with you. What are the biggest barriers to health equity in HCT and cellular therapy?
So I think this is a really important question because defining equity is something that we get to do. The WHO reports that 30 to 50% of healthcare outcomes are related to social determinants of health. So all those incredible survival Kaplan-Meier curves, half of that has nothing to do with us, but has everything to do with the patient's context. And that differs all around the world. So it's really important that we understand what are the local barriers to care, wherever we're talking about, and to consider not only the economic issues in that country or for that patient, but also the invisible biases we hold as clinicians and healthcare providers and institutions. And with bone marrow transplant, obviously donor access is an issue, geography is another, but there are many. And so the important thing is to think about this holistically in an intersectional lens in terms of what are the variable barriers to access and to improved outcomes for that specific context.
And Sunil, perhaps you could speak from your specific context. Any particular barriers that you'd like to add?
So I agree what Nada said, but there would be awareness of the general community at large. The physicians, or the referring physicians, awareness and the myths they hold regards to stem cell transplant. Also, donor backouts and the registries. The number of people on the registries are too small. Some of the countries, geographies do not have the registry of their own at all, and if they have, there are myths with the donors. Even the family matched donors. Sometimes the families do not come forward for donation because of myths associated with the donation process itself. And with unrelated donor process, for example, there's a lot of backouts which happen, and even though they're registered donors who are matched, they don't come forward for transplant at all when it's time to donate.
And Nada, in addition to the barriers you've already mentioned, are there any particular systemic challenges that are faced?
I mean, institutional challenges are variable wherever you are, whether it's resources, whether it's specialist care, access points. For example, even in resource not so limited settings, I'm always surprised when I talk to colleagues that yes, sometimes we don't have access to an ophthalmologist or a gastroenterologist to do endoscopies at a drop of a hat for graft versus host disease assessment. Nevertheless, we still do these transplants, and so we make do, we improvise, we strategize to create a balanced and a good outcome for the patient.
Sunil, let me just ask you a little bit about haploidentical transplants for thalassemia. Can they help address these disparities in HCT access, and especially where donors are limited?
Yeah, just for the perspective, thalassemias are one of the most common indications of transplant, especially for pediatric population are a part of the world. The subcontinent, India, the subcontinent, the countries around it, they are the thalassemic capital of the world. So in our country, for example, 30% of all the pediatric transplants are thalassemia transplants. And you'll find a matched donor in only about 25 to 30% of them. And maybe another 10-15% of them may have an unrelated donor, which leaves a large majority of the patients who require a transplant for thalassemia or for that any hemoglobinopathy do not have a donor for them to donate. And here comes the role of haploidentical transplantation, and it would, I think, bridge the gap, at least till our registries are more mature. We have a large number of donor in the registry pools, and the ethnic mix is there where we can find donors for our patients. But till that happens, I think haplotransplant is a very attractive option for them. And the experience and the need has shown us that the outcomes can be really good, in this patient cohort as well.
Nada, we are at EBMT 2025. How can organisations like EBMT help close gaps in access to advanced therapies? What's the role there that they can play?
The role is huge because this is the platform that researchers and clinicians have to disseminate the information that they hold. Whether it's data, whether it's clinical experience, whether it is perspectives from a system level or an institutional level. So EBMT and other similar organizations really need to make space for those voices to be heard. And although we have equity, diversity, and inclusion sessions, they need to be bigger. We need to have bigger platforms. We have incredible data published recently in The Lancet on CAR T technology developed in India. I mean, at a cost that is a fraction of what currently is available around the world. There is a lot to learn from a global perspective, whether it's from clinical practice or from research that is highly valuable. And I think opening up that perspective in societies, particularly in science, it's everything.
And just to finish very quickly, do you both, and I'll come to you both, do you both think that we are moving in the right direction, and how hopeful are you for the future? Sunil, very quickly, and then...
Of course, I think it's exciting times, and we are all making this world a better place for our patients in the future to come. The great examples have been collaborations in the context of cell and gene therapy, and I think Nada just mentioned we manufacture in India CAR-T therapies at a fraction of the cost which is available globally, and that has been possible by the collaborations which we had with our colleagues out of the country. So that's a great example of that. There's also, there has been an inherent, I would say, bias in the past of engaging these countries in the clinical trials and taking the science forward, which is changing, and we are now engaging with our partners from the West in a lot of these clinical trials and getting answers to which are specific to the geographies, and also helping enrollment faster because we can provide a large number of patients in these clinical trials. I think these are some of the changes which have happened, and we're looking forward to a very bright future.
Nada.
100%. We're definitely in the right direction. This is the best time to be alive. Technology is incredible. AI is here. I mean, what is ahead of us can only be better than what we've had before. And the fact that equity is center stage in conversations and in policy design in a way that is extremely practical, that can only be the better future that we hope for.
Nada, Sunil, thank you both so much for joining us. It's been great to have you.
Thank you so much. It's been a pleasure.